Let's see the difference between the lobar pneumonia and bronchopneumonia. This is the table from the pathology book of Dr. Hars Mohan sir. So first definition. We already aware that in lobar pneumonia the whole lobe or the majority of the portion of lobe is involved, right? Entire lobe is involved. The inflammation is of entire lobe, while in bronchopneumonia the inflammation is patchy. Only focal areas are involved. Age group. In lobar pneumonia commonly seen in adult population, while bronchopneumonia is seen at the extremes of age, particularly infants and old age. Predisposing factors usually more often affect healthy individual, right? There is a predisposing factors is not necessary to see in the lobar pneumonia development, right? It usually affect the healthy individual, but bronchopneumonia usually develop when the patient is having pre-existing illness like that of chronic debility, terminal illness, flu, measles, etc., or predisposing viral infection, right? Measles and flu are the viral infection. So predisposing pre-existing disease is present in bronchopneumonia while it might be absent in lobar pneumonia. The common etiological agents for development of lobar pneumonia is Staphylococci, Streptococci, Pneumococci, and the Klebsiella pneumonia. While in the bronchopneumonia, Staph and Strepto is the same, but Haemophilus influenza and Pseudomonas also responsible for development of bronchopneumonia. Pathological feature in the morphology, in the lobar pneumonia, classically four Laennec stages are seen. The inflammation is in the four stage, right? Congestion, red hepatization, gray hepatization, and resolution. While red hepatization and gray hepatization also known by the name early and late consolidation. So the four phase is present in lobar pneumonia while it is absent in bronchopneumonia. In the bronchopneumonia, usually patient have patchy consolidation in the lung, alveolar exudation, thickened septa, right? So classical four stages of inflammation is not seen in bronchopneumonia. Investigation. If you do the X-ray, then in the lobar pneumonia, entire lobe is consolidated, while in bronchopneumonia, focal consolidation is seen. Prognosis. Lobar pneumonia better response to the treatment. Resolution is common. Prognosis is very good. But in bronchopneumonia, the response to the treatment is variable. Organization can occur and patient can have poor prognosis. Complications. Usually less common in the lobar pneumonia. Pleural effusion, empyema, lung abscess, organization like that of complication can develop, but it's a less common. While complication is common in bronchopneumonia, particularly bronchiectasis can occur. Other complication is same like that of lobar pneumonia. So the chances of complication is more on bronchopneumonia. So we can say that in the bronchopneumonia, usually patient is having poor prognosis, right? So this is the difference between lobar and bronchopneumonia.